Welcome to Critical Health Issues News Channel. I am Jacobi PB, and these are my other anchors.
I'm Martest Sheffield.
I'm Aykiera Haley.
I'm Bobby Roberts.
And today we'll be talking to you guys about racial and ethnic health disparities.
So, part one, what are health disparities? In 2018, racial or ethnic health disparities has been a topic of controversial conversation, with some individuals believing in its existence and others dismissing the information because others believe society is the biggest determinant in health. Health disparities usually refers to the differences in the health status of different populations of people. For instance, when looking at health coverage of African Americans, 46% of non-elderly Black adults who do not have insurance report having one or more chronic health condition. Furthermore, asthma is also the highest amongst African American children. African American kids have a 260% higher emergency department visit rate, a 250% higher hospitalization rate, and a 500% higher death rate from asthma compared to white children.
So part two, health disparities vary within ethnicity and race. So overall, Americans, they do live longer, healthier lives than ever before social, public health, and medical technology advances. Unfortunately, not every community benefits from these improvements. Health disparities, differences in health outcomes among groups often are driven by the social conditions in which people live, learn, work, and play. In the United States, these differences are caused by a complex array of factors, which makes it impossible to devise a single policy solution for all instances of health inequality. Health outcomes include whether a disease or condition gets better or worse, what the costs of and care are, and how satisfied patients are with the care they receive. They focus not on what is done to the patient, but what results from what is done.
Okay, so part three, basically how do these disparities coincide with access, cost, and quality? Access, cost, and quality affect these disparities within the minority population a lot more than it would the majority population. Basically, when it comes to access, cost, and quality, you'll notice a lot of differences that the higher majority are afforded based on when it comes to their access to the health, their cost of their health, they can afford it more, and whereas the majority of the people have access to all of their health options. You'll notice that the lower majority have trouble finding better quality services. They also don't have as much access depending on where they live, where they grew up, and the issues or diseases that they may encounter. The issues and the diseases that the lower community are facing, they are unable to provide treatment for those diseases due to their cost issues, their socioeconomic statuses, or their way of living. Also, depending on where they live, you'll notice that a lot of the minority communities do not have as many hospitals, as many healthy options, also do not make as much money to afford the healthier options in order to live a longer lifespan.
Okay, so part four basically talked about how genetic disorders or how ethnicity and race how genetic disorders can be linked to ethnicity and race. According to the National Institute of Health, there are genetic disorders that are more common amongst individuals who collectively trace their ancestry to a specific geographical area. And that these people from these geographical areas share similar genes which are passed down through their ancestry. These genes contain a disease-causing mutation, and a particular genetic disorder may become prevalent within this particular group because of this disease-causing mutation. An example of one of these genetic disorders would be sickle cell disease. This is more common amongst those who are of African or Mediterranean descent, and the prevalence of this disorder can be linked to similar genes that contain a disease-causing mutation which is shared amongst this group of people. These genes are continually passed down from generation to generation, making those of African American and Mediterranean descent more susceptible to developing disorder than individuals of any other ethnicity or race.
Alright. Racial and ethnic disparities in the healthcare isn't the easiest topic to discuss with individuals of different backgrounds. However, it's prevalent in today's society, and it's a conversation we must have. My group and I are all of African descent and have in one way or another experienced the health disparity that our family shares in common. We all have a relative that has been affected by high blood pressure or diabetes. If adequate food is not dispersed evenly throughout different populations and people are not getting the right amounts of exercise, health disparities will continue to persist. I believe the government should support research to identify effective strategies to help eliminate health disparities. Also, the government should standardize and collect data to better identify and address disparities. America benefits when everyone has the opportunity to live a long and healthy, productive life. This can only be achieved if we work together and treat everyone the same.
Okay, so basically from all of that, we're given the conclusion of knowing that although the disparities can't be completely tarnished or done away with, what we can do is learn different ways to lower the disparities in our minority communities. A lot of things people don't know is higher stress among minorities and low-income populations can also lead to disparities. And I read an article that basically stated that if psychologists would reach out to some of the minorities, we can lower disparity rates also with the health, on the health spectrum. Simply saying that we should be talking to our minority groups, encouraging them, uplifting them, and just speaking to them, reaching out so they can lower their stress levels, because also the stress can be a big disparity when it comes to minorities. They can stress about not having access to their health, they can stress about the quality of service, their access to certain food options that aren't as healthy, but stress is a big factor. And anchors, any
Also,
tidbits, add-ons?
yeah, like I mentioned earlier, how I said some individuals do dismiss like health disparities and like say that the biggest determinant of health is society. Given the fact that like even though that I live in a community where the black population is less than 20%, I still see the health disparities in my own family and other families that I do see like a correlation. My father does have high blood pressure, my grandfather has diabetes, and so does my grandmother she has diabetes, and my mother and my mother's mother has breast cancer, which are all three diseases that are prevalent in a black community, regardless of social status or socioeconomic standards. So I feel like everything does affect black people the same, regardless of where you are at, regardless of like, you know, where you live, and just like, I feel like we do need adequate food, the same food everywhere, and this is like places easier to exercise, so, you know, everybody can stay in shape and so forth.
So unfortunately, there's always going to be a gap. But how do you guys think we go overcome this, like, the disparity?
I feel that as a community, we would have to take a stance more just to show the government or show like our Tallahassee governors or senators that we do not have as much equal access to everything. Like it's a big line between South Side and North Side. South Side has no Publix, no organic stores, barely any gas stations. North Side, you see all the gas stations, you see the Subways, the Publixes, the organic shops. Like it's just a normal line where people can see that there's a problem, but it's up to us to make it work and change. So that concludes our news channel for today. Thank you for watching.
Bye-bye. Yeah, I'll just,
That beep was our 10 minutes, so
Really?
yeah.
I lucky felt like we could have even still kept going for a minute.